Hello, welcome back. The topic today is hunger and diabetes or blood sugar level. So most of the diabetic people, they think whenever they have whenever they feel hungry, so they think their sugar is low. No, that's not true. It could be, high sugar also. They can feel hungry, or even low sugar also. So they got to be very careful. So first, what's happening in the diabetes? See, normally, what is hunger? See, we all know, either because of our natural lifestyle, like my breakfast, lunch, dinner, we used to feel hungry at that particular time. So morning 8 o'clock, so if we feel hungry because of the usual thing, we may eat food. Same thing, lunch and dinner. But what happens in the diabetic people? Diabetes, usually those days, or with the history, the classical, the history will be polyphagia. That means they'll eat more. Their appetite is they feel always hungry. They eat more. And polydipsia, they always feel thirsty. And polyuria, they urinate a lot. So these are the polyphagia, or eating more. It's all because of one simple reason. In diabetes, the blood sugar is very high, either because of low insulin or no insulin, or insulin resistance. Whatever it is, the blood sugar is very high. But the blood sugar, though they're very high, it cannot go into the cell, your brain, heart, or even the natural blood tissues, or even the normal tissues. They need sugar for their function. When there is no sugar, they feel tired, they feel hungry always. So they eat a lot, so that they can push. They try to push the sugar inside, but it won't happen. So they keep on eating. The sugar is high, but we need insulin for the transport of sugar from the blood into the cell. So that is where the diabetes happens. There is no insulin, so no sugar is transported. So they feel always hungry. They always eat, but they are not satisfied. So they polyphagia. Okay, even a low sugar, naturally, they're taken some medicine, tablets or insulin. The sugar goes low, especially below 80 milligrams or 70 milligrams. So naturally there is no sugar in the cell, though there is a transport, but the cells, they don't have uh, uh, sugar. So naturally the body stimulates them to eat food. It's a protective mechanism. So, but here the difference is, they may feel shaky, they feel blackouts, they sweat a lot, they feel tired, so they feel hungry. The body pushes them to eat food, so that the sugar rises, the cells get the sugar, and they can feel safe. So this is second part. Third, in diabetes, their steroid level is always high. Either it's because of the low sugar or high sugar or insulin resistance. Steroids are very high, and diabetes is always a stressful condition. The steroids are completely against the insulin. So when low sugar, they make the insulin not to work. So the steroid level increases. Even high sugar, they are in the stress. The body secretes more in steroids. So the quality of the steroid is, they have so many these things, but they increase the hunger. So they feel always hungry because of the steroids. Then next is, people are taking medicines, like for diabetes, oral medicines, especially metformin. Metformin is a wonderful medicine for diabetes, but when you take it for longer years, days, they can irritate the stomach, causing gastritis. So that can also cause a kind of feeling hungry, a false hunger kind of thing. So because uh, it erodes his stomach as it touches the area, so they feel the burning sensation, or they feel hungry. So they eat something, especially something cold or even bland diet, that keeps they feel happy. So that also makes them eat more. They always feel hunger. It's actually false hunger. So that is a truth. Okay. The other one is, all diabetics will have a yearly gastric emptying time, or short gastric emptying time. What is that? Normally, when we eat food, the food has to stay for digestion in the stomach for 2 to 2.5 hours. But in diabetic, the transit time is very short, so the food gets out of the stomach within 30 minutes. So the stomach is always empty, so the acid secretes and erodes, they feel hunger. So if you are diabetic, you feel hunger, it could be, most of the time it's all because of high blood sugar. Need not be always low sugar. And it could be because of low sugar if you have a shaky hand, sweating, palpitations, already tired, all these things. The third is because of the steroids. Fourth one is because of the medicines. Medicines cause gastritis. They can feel a false hunger. And the fifth one is, like as I said, so these are the reasons in diabetes people always feel hungry. So always check your blood sugar. With the glucometer is enough. Check your blood sugar whether you have a hyperglycemia or hypoglycemia, and take proper measure. Thank you.